If you're a man over 50 and you find yourself waking up several times a night to use the bathroom, you're not alone. Many men shrug it off as just another part of getting older. But what a lot of people don't realize is that these nighttime bathroom trips, along with a few other subtle changes, are often early warning signs that the prostate is enlarging. These symptoms usually creep in slowly, so gradually that you adapt without even noticing, until one day you realize your sleep is shot and your daily routine revolves around knowing where the nearest restroom is. Understanding what's happening early can make a huge difference, because this is a common, manageable condition when it's addressed in time. To understand why these symptoms happen, it helps to know what the prostate actually does. The prostate is a small gland, roughly the size of a walnut, that sits just below the bladder and surrounds the urethra, the tube that carries urine out of the body. Because the urethra passes directly through the prostate, any change in the size of that gland can affect how easily urine flows. As men age, the prostate often grows. This growth is called benign prostatic hyperplasia, or BPH. Benign means it is not cancer, and hyperplasia simply means an increase in the number of cells. In other words, BPH is a non-cancerous enlargement of the prostate. BPH is extremely common. Studies show that about 50% of men between the ages of 51 and 60 have some degree of prostate enlargement, and by the time men reach their 70s, that number rises to around 80%. It's important to be clear here. BPH is not prostate cancer. They are different conditions. However, they share similar risk factors, especially age, and they can exist at the same time. That's why symptoms should never be ignored or self-diagnosed. Most urinary symptoms in older men are caused by prostate enlargement rather than cancer, but only proper medical evaluation can rule out more serious issues. A simple way to picture what's happening is to imagine the urethra as a garden hose. When you're younger, that hose is wide open. As the prostate enlarges, it starts to squeeze the hose, creating a partial blockage. That pressure is the root cause of nearly all the warning signs linked to prostate enlargement. The first and most common warning sign is frequent urination, especially at night. This symptom often begins subtly, maybe with one extra bathroom trip before bed or one nighttime awakening. Over time, it can progress to 2, 3, or even more trips each night. Waking up to urinate 2 or more times per night has a medical name: nocturia. Research shows that nocturia affects more than half of men over 60, and prostate enlargement is one of the leading causes. This happens for a couple of reasons. As the prostate presses on the urethra, the bladder has to work harder to push urine out. That extra strain can make the bladder muscle more sensitive and irritable, triggering the urge to urinate even when the bladder isn't full. At the same time, the blockage prevents the bladder from emptying completely. When urine is left behind, the bladder fills up again more quickly, which means the signal to urinate comes sooner than it should. The result is frequent trips to the bathroom, day and night. The impact goes far beyond inconvenience. Chronic sleep disruption is linked to fatigue, poor concentration, mood changes, and a higher risk of conditions like high blood pressure and depression. If you're constantly tired, your prostate may be playing a bigger role than you think. The second major warning sign is a change in the strength and consistency of your urine stream. Many men notice that their stream becomes weaker or slower over time. Instead of a strong, steady flow, it may feel thin or lack pressure, and it takes longer to finish urinating. Some men also experience a stop-and-start pattern, where the stream pauses and then resumes without warning. Another common complaint is dribbling at the end of urination, even after you think you're finished. These changes are classic signs of obstruction. The enlarged prostate physically narrows the urethra, making it harder for urine to pass through smoothly. While this usually isn't painful, it is a clear mechanical signal that the urinary tract isn't working as efficiently as it should. The third warning sign involves a combination of urgency, hesitancy, and a constant feeling that the bladder isn't fully empty. Urgency is that sudden, intense need to urinate that feels impossible to ignore. It can come on quickly and force you to rush to the bathroom. This happens because the bladder muscle, strained by the obstruction, can begin to contract unpredictably. On the flip side is hesitancy, which is difficulty getting the urine stream started. You may stand there waiting, needing to concentrate or strain before anything happens. Even after you finish, you might walk away feeling like there's still urine left behind. In many cases, that feeling is accurate. Studies show that men with moderate to severe BPH often retain significant amounts of urine in the bladder after voiding. This incomplete emptying fuels the cycle of frequent urination and urgency, keeping the bladder in a constant state of irritation. Many men wonder whether these symptoms are really serious or just an annoying part of aging. The truth is that untreated prostate enlargement can significantly affect quality of life and, in some cases, lead to real medical problems. Men with ongoing symptoms often limit travel, avoid social activities, and experience anxiety about being away from a bathroom. Beyond lifestyle effects, retained urine can increase the risk of urinary tract infections, bladder stones, and bladder damage. Over time, the pressure can even affect kidney function. While severe complications are less common, they highlight the fact that BPH is a progressive condition that deserves attention. If any of these warning signs sound familiar, the most important next step is to talk with a doctor, ideally a primary care provider or a urologist. These symptoms are not something you simply have to tolerate. Evaluation usually starts with a detailed discussion of symptoms and a physical exam, which may include a digital rectal exam to assess the prostate. Simple tests like a urine analysis and a PSA blood test are often used to help rule out infection or prostate cancer, while blood in the urine, blood in the semen, or persistent pain in the back, hips, or pelvis are not typical of BPH and may raise concern for cancer. Only proper testing can provide clarity. The good news is that prostate enlargement is very manageable. Mild symptoms may improve with lifestyle changes, such as adjusting fluid intake or timing medications. More bothersome symptoms can often be controlled with medications that relax the prostate or shrink it over time. For men who need more relief, modern minimally invasive procedures offer effective results with relatively quick recovery. In the end, the 3 warning signs to remember are frequent urination, especially at night, a weak or interrupted urine stream, and the combination of urgency, hesitancy, and incomplete emptying. These are your body's signals that the prostate is changing. Prostate enlargement is common, treatable, and nothing to be embarrassed about. Taking action early can restore sleep, protect long-term health, and greatly improve quality of life. Don't dismiss these changes as just getting older. Get them checked and take control of your health.